I'm very happy to announce my two fellow speakers for today. We have a stellar roster. Omotola Thomas is truly an ambassador in every sense. She lives with Parkinson's. She's an ambassador for the World Parkinson Congress and is also a writer and a speaker and the founder of ParkinsonNet, a blog that she has established to chronicle parts of her own journey with Parkinson's. And she strongly believes in the power of a positive mindset, and you will hear that today. And she promotes that message through her site, ParkinsonNet. And she's a volunteer very extensively for various causes. And lovely to have you on board, Omotola. And equally proud and happy to have Dr. Ascherio, who is a well-published author in the field of epidemiology at large, certainly also in Parkinson's disease. Italian by background, so makes him perfectly suited for this discussion on nutrition. There's no better food in the world than in Italy. Decided to move on from Milan, where he has studied medicine, to now live and work in Boston, where he received his doctoral degree in epidemiology in 1992, is now on the faculty at Harvard, a very prestigious institution, if not one of the most prestigious ones in the world. He's done a lot of work on Parkinson's disease, in particular epidemiology and studies of large cohorts, followed for over time for up to 30 years. And it's lovely to have you on board here, Alberto. So what I'm going to do is start with a brief PowerPoint presentation on nutrition and Parkinson's. My main disclosure, and I would just want to start briefly because the reason we're doing this webinar series is the book that has recently come out. It's called Ending Parkinson's Disease. It's a provocative title and a title that should hopefully generate a lot of hope. We feel that 2 centuries of Parkinson's is enough. This is the cover of the book. And the reason was a paper that my good friend and colleague and also an author on the book, Professor Ray Dorsey, that he and I published in the leading journal JAMA Neurology some 2 years ago, about warning about the fast rise in new people with Parkinson's. We've now come to understand that Parkinson's is the fastest growing neurological condition on the planet. And the numbers are expected to double in the next years to come. And we think that this is at least to some extent because we are doing this to ourselves. Just like the pyramids, we feel that Parkinson's is at least to an extent a man-made disease. And if you come to think of it, Parkinson's disease was first described by James Parkinson in London in 1817 when the Industrial Revolution was taking place. The disease is now doubling at an incredible rate in China, where this photograph was taken, and where they are now having their industrial revolution. Other factors that we're particularly concerned about and that we'll be talking about today is pesticides. This is the use of paraquat today in the United States. Paraquat is extremely toxic to exactly those areas in the brain that are involved in Parkinson's, substantia nigra, the black matter. It's forbidden in 60 countries in the world, but it's still used abundantly in the United States. In my own country, in the Netherlands, we use the little sister of paraquat, which looks just like paraquat, has never been tested for toxicity. And we're spraying it on our fields today worldwide. And we think this is a shame and we should do something about it. So in this book, we launch a call to action. I've said on many occasions that people with Parkinson's are among the friendliest and nicest people on the planet. And I genuinely think so. But at the same time, you're maybe being too nice and too kind. What we're saying in the book is that in the 80s, when HIV turned out to be the cause of AIDS, and HIV patients literally chained themselves to the front doors of big pharma companies, demanding better treatment. And now, fortunately, HIV infections have become a chronic disease. I'm not saying that people with Parkinson's should chain themselves to the doors of pharma companies, but I think we should raise a voice for more money for research, more money to cleanse the environment, better treatments, better care. You all deserve good care, good treatment, and we need to protect our future generations from becoming Parkinsonian. So if you're interested, please buy the book. You can order it through this website. And just to reassure you that I'm not promoting my own income here, the authors are donating all their proceeds to the eradication of Parkinson's. So all efforts go to Parkinson charities. And just, well, I'm just going to show the book to you here, and let's see how we're doing for time. And in the end, I may read a little portion of the book. The reason I think we're so excited about diet, and I came to prepare this talk, it is a really hot topic in the field of Parkinson's. Alongside with exercise, lifestyle interventions are the big new kids on the block when it comes to improving your symptoms, and who knows, perhaps slowing down the progression of your disease. The latter has never been demonstrated. We have hopes it could be the case, but the links between a healthy diet and the risk of developing Parkinson's or having a better life when you have Parkinson's are abundant. Just so you know, and if you're interested, I'm sure that Abby can make sure that you get this. There is a guideline in English written by my team about all the dietary issues for Parkinson's. And happy to share that with all the folks on the line. Make sure that you reach out to Abby, ask for it, or that we make sure that everybody on the line today gets it. And on the right, you can see a cookbook, which is only available in Dutch. Perhaps we should make that available in English. But it's essentially the guideline intermingled with nice recipes for people with Parkinson's. This is a paper by Professor Ascherio, who's on the line. I'm showing this paper because he very nicely has this cartoon in the paper in the Lancet Neurology, one of our leading journals. And he nicely shows that there are risk factors and what he calls inverse risk factors, or you could say protective factors, that mitigate the risk of developing Parkinson's disease. And we now know that, I'm just going to highlight very briefly a number of issues so that we have a menu for the discussion later on. We now know that, for example, lifetime exposure to dairy products, milk, cheese, butter, is associated with a higher risk of developing the disease in the future. We think this could be related to the pesticides, which may find their way into these products via the cattle eating contaminated grass. And this is a meta-analysis, a paper published showing, this is a complex cartoon, but this is a summary of all the studies that have analyzed the risk of developing Parkinson's. And you see the vertical line in the middle, and if all the studies that are on the right show an increased risk, and you see that there is an increased risk related to dairy products for all folks, and it's particularly high for men. Why that is still unknown, but this is what this study suggested. And here is the higher the milk intake in grams per day on the x-axis, the higher your relative risk of developing Parkinson's. So this is for healthy people who are at risk of developing the disease in the future. And as Professor Ascherio had pointed out in his paper in the Lancet Neurology, there are also protective factors. This is a photograph of the delicious Mediterranean diet. Alberto used to eat this as a kid every day. And we now know that perhaps having such a diet on a regular basis might reduce the risk of developing Parkinson's. And this is a very famous paper that came out last year, which again drew attention to the Mediterranean diet and the risk of developing Parkinson's. And then caffeine intake, and I'm sure Professor Ascherio will take this further later on in the discussion. Regular caffeine intake also seems to be inversely related to the risk of developing Parkinson's. Another issue is when you already have Parkinson's. So now we're taking a little step away from the risk of developing the disease in the first place to now having the disease. One issue that is particularly concerning is weight loss. This is a paper that we published, a meta-analysis showing that the more severe Parkinson's become, the more pronounced the weight loss is. And other papers have shown that weight loss is a bad sign. It's a sign that your Parkinson's is now in a more difficult phase. And conversely, we feel that mitigating the weight loss, maintaining adequate nutrition, could improve your prognosis. And alongside with weight loss and lack of a healthy diet comes malnutrition, lack of vitamins and lack of other healthy parts in your diet. This is the reason many patients, and I want to mention this explicitly now so we can open it up for discussion, have resorted to taking vitamins. Now, we always say that if you take a regular diet, supplements are not necessary. An exception is perhaps vitamin D. Many people, particularly when you age and particularly when you're a woman, are at risk of developing a vitamin D deficiency. And there is some fascinating anecdotal reports of people taking vitamin D experiencing improved motor symptoms. Vitamin C is interesting for two other reasons. One is all of you folks, but particularly the women, are at risk of developing a bladder infection, and a bladder infection can trigger a cascade that leads to worsening of your Parkinson's symptoms. And taking vitamin C helps to acidify the urine and thereby prevent bladder infections. The same holds true for the good old-fashioned cranberries. The most famous textbook of internal medicine, in fact, mentions cranberries as a way of helping to prevent bladder infections. So that's a very simple measure that you can use, because bladder infections is bad news for people with Parkinson's. And the other really interesting thing is that ascorbic acid, vitamin C, helps to improve the uptake of levodopa. Not for everyone, but for patients with a poor uptake of levodopa, combining the intake of your levodopa with 200 milligrams of ascorbic acid in this paper led to a better uptake of the levodopa medication, the Sinemet or the Metapar. So not for all of you, but it's worth trying. There are also vitamins that have been tested and that were negative. Vitamin E has been taken to the test, is not effective for people with Parkinson's. I know many people take all sorts of supplements, such as curcumin, can't even properly pronounce it. No evidence for this. By the way, when I say no evidence, that's not to say it doesn't work. It means that there is no evidence to support it. So I won't prescribe it as a physician. If you take it nonetheless, happy to pay the money for it, and you improve, I'm obviously happy. No evidence for glutathione or other antioxidants have been taken to the test. Studies were negative. Co-enzyme Q10, commercially available, been taken to the test, not effective. Again, you're free to do it, spend money on it, but the research is not convincing at all. And you could say, well, why don't I take it? It doesn't have any side effects, and that's not true. Even vitamins can have severe side effects. Vitamin B6, as a notorious example, paper in the New England Journal of Medicine, can be very toxic to your nerve cells if taken in an overdose. So don't think, let's just do it and it won't harm me. It can, in fact. Another big thing in our clinic is constipation. All patients with Parkinson's are at risk for developing slow bowel movements, and a protein or a diet rich in fibers and perhaps probiotics. This is one study published in Neurology suggesting that the bowel movements were improved with high fiber diet and also combining it with probiotics. I have to say, it's early days for probiotics. They could also change your gut microbiome in an unwanted direction. So this is still very early days, but high fibers to treat constipation and drinking a lot is certainly helpful. An issue that's always at the table when seeing my patients is proteins and levodopa. For most patients, although not all of you, taking your medication with a protein-rich meal, including dairy products, but also including meat, for example, can reduce the intestinal absorption of your levodopa. So you need the proteins in order to keep up your muscle strength and avoid weight loss, but try to spread the proteins over the day and avoid peaks, in particular peaks simultaneously with levodopa intake. And then there is orthostatic hypotension. This is a brilliant photograph from England, you know, the famous guards at Trafalgar Square, and one of them fainted. This is lack of blood in the brain. It's called orthostatic hypotension. This is common in patients with Parkinson's disease, and taking some extra salt can help to treat orthostatic hypotension. A bit of hypertension is the least of your worries once you have orthostatic hypotension. So that's a simple measure. And taking a glass of ice cold water in the early morning triggers your autonomic reflexes and is also a helpful way of treating this orthostatic hypotension. And just finally, I will touch upon it. I know there's a question about this. The ketogenic diet. This is a diet where you eliminate all carbs from your diet so that your body now needs to make energy from ketone bodies. Very few studies in the field of Parkinson's, not very convincing yet. It's theoretically maybe attractive, but this is not an evidence-based treatment for people with Parkinson's. And finally, this is only work being done in rodents, but I hear a lot of my patients talking about it. The darker the fruit, apparently, the more antioxidants are in the fruit. In rodents, this helps to mitigate the risks of certain toxins for the substantia nigra. Whether or how that helps your Parkinson's is still unknown, but it's probably healthy to eat a lot of dark fruit. So that's my general background. Before opening up the floor for the discussion from the people in the audience, I first want to ask Professor Ascherio, you're an epidemiologist, and what I've shown is a lot of studies showing an association between a particular food measure, such as dairy intake, and the risk of Parkinson's. Does an association mean that it's definitely the cause, or how should people interpret these findings in the literature?
Okay, well, I think as most people know, an association doesn't imply causation by itself. So the essence of our investigation has been to try to distinguish association that may reflect an artifact or confounding, as we say in the field, from a true causal effect. That is where I would say, 90% of our effort go. And how we do that? By trying to control for all those factors that could confound the associations. Even so, we can get to some degree of probability. So it's a matter in the end of judgment. There is nothing we can prove like in a mathematical equation and say this will do that. The conclusion will always be, if you eat more of this, you're more likely, less likely to get Parkinson's disease than if you do not. But the certainty is not part of the field.
Yes. And out of the factors that I mentioned, Alberto, which are the ones that you think have the strongest evidence base?
Well, I think the healthy dietary pattern is where there is some convergence, probably more convergence than specific nutrients, in part because it's easier to distinguish, rank people according to a healthy versus unhealthy diet. So there are consistent behavior over many years. We have a large number of people who do follow a healthy dietary pattern, other with, eat sausages and hot dogs and in fried and processed food most of the weeks. That allow a nice contrast, and there is I would say all the data that we've been looking at are pointing in the direction of a protective effect on risk of developing Parkinson's disease.
Yeah.
And that fit also with the biology, as you mentioned, the antioxidant and the biological mechanism. So there is a lot of convergence there from animal model, and human studies.
All right. Well, I'll come back to you with other questions later for sure. Omotola, how does this resonate with you, and what does your diet look like?
The whole subject of nutrition and Parkinson's is a very complex one, not just for me, but I believe for many Parkinson's patients across the globe. I think personally for me and a lot of people, I know what to do theoretically and things to eat. Practically doing that is a different story on its own. I saw the picture of the Mediterranean diet that you put up and it looked really nice, but I didn't grow up eating those foods. I'm going to be 40 this year, so trying to undo 39 years of a certain eating pattern is not necessarily an easy thing for me to do. I was really happy to see the dietary guidelines for PD and the cookbook. I would like to request that you please make it in English. I didn't know that that was available. But I think the issue of diet and nutrition is quite confusing. Are there different dietary requirements for women, for men, for older people, for younger people? Yeah.
All right. Very good. So we'll turn to a few questions of the audience. There's a remark by Bev Ribaudo. Bev, thanks for joining. With a tip for all of us, vitamin D liquid is available as a sublingual drop in an olive oil base. Sounds delicious. 1 drop a week keeps my D levels within range. Like I said, I'm positively inclined towards vitamin D. Have it measured is what I would recommend. Don't just suplete it blindly. Have it measured, particularly when you're a woman, particularly when you're postmenopausal, but even men. And this sounds like a very attractive way of replenishing your vitamin D levels.
What about,
go ahead.
Sorry, what about vitamin B? I don't think you mentioned that in your slide, and there's a lot of talk and studies and research about that.
Yeah, I think Alberto and I can maybe both answer it. I can take the first stab. So one of the concerns is that maybe levodopa use can be associated with vitamin B deficiency. The most pronounced example of this is people on the duodopa, which is not maybe available in all countries, but this is the levodopa gel that's inserted right into your intestinal system through a PEG tube, so straight through the abdomen into the intestine. And there have been people developing a severe vitamin B deficiency. Whether this is the levodopa gel directly or the tube is not entirely clear. But there are certainly hints that Parkinson's and or its treatment is associated with vitamin B deficiency. I think this is a minority. The best recommendation is to have it measured and not to blindly suplete it. But I think it is worth measuring it. And the latest Dutch guideline now recommends periodic vitamin B measurements in people with Parkinson's, not routine suppletion. Does that answer your question?
Yes, it does. Thank you.
Do you have additions, Alberto, based on your reading of the literature?
No, the data on risk of Parkinson's disease are not, they're not very strong. It doesn't exclude the possibility that there is a role of vitamin B and B12, but we don't see a clear, strong signal.
Right. I've also been notified that the link to the Dutch or the English dietary guideline is now available in the chat. So check it out yourself, copy the link. I will also make my slides available for all of you after my presentation. So that was another question. There's a remark by Mark van Gieken, who is Dutch, a fellow Dutchman. He lives in Scotland. He says, as a Dutchman, I consume lots of cheese. We all do. We say papa, we say mama, and then we ate a chunk of cheese after we're born, as many Dutch do. Is there a notably greater number of patients with Parkinson's in the Netherlands? And the answer is no. And probably, there are many risk factors for Parkinson's. And it's not the dairy products itself. It's probably, we think, the pesticides that make their way into the dairy products. In the book, Ending Parkinson's, there's a very compelling story about Hawaii, where a certain pesticide called heptachlor was used to spray it on pineapple crops. and the heptachlor made it into dairy milk that was available in supermarkets. It made it to breast milk that was fed to young infants in measurable concentrations. And I think that is outrageous. So, and because pesticides can also find their way to people in other ways, apart from milk, there's not a specific cluster in the Netherlands, but certainly the association between dairy products and Parkinson's is there.
Bas, I just wanted to chime in too and say there's over 20 questions in the Q&A tab. This is just the chat, so the majority will be down below under Q&A.
Good, good. Here's your high-tech professor looking under the wrong button. All right. Patricia Bellman, welcome Patricia, thank you for joining. How important are organic foods? That is a very relevant question. I can tell you, as far as I know, perhaps Alberto can chime in, there have been no studies specifically on organic foods. I can tell you, I eat organic foods. We promote organic foods in the book for the simple reason that I'm very worried about the link between pesticides and the risk of Parkinson's. No formal evidence, but I recommend it to all of you. Alberto, would you have anything to add here?
I agree. The problem is pesticides. So the main reason organic food would be better, that is less likely to contain pesticides.
For those who are unable to afford organic foods, do you have any recommendations of what to do, how to clean the fruits and vegetables that they eat?
Yeah, I think, washing thoroughly could be useful. And also, unrelated to Parkinson's disease, but some of my colleagues have been working on pesticide residues on vegetables and looking at which vegetables have more pesticide than other, and identifying, they call them the dirty dozen, those vegetables that really need extra washing. I don't have the list at hand, but I can refer to that literature as a point of reference.
I'll just chime in and say, for me, because of the loss of my gross motor skills, washing fruits is quite difficult. So I try to use a brush. That makes it easier, but I can't really maneuver an apple underwater with my hands.
I understand.
Yeah, good practical advice, Omotola. Thank you. So Matt Eagles, welcome, Matt. Nice to see you here again. I take Arctic fish oil every day, as I've been told it's really great for brain health. Is it, and how will I know? Well, to the best of my knowledge, that's never been tested specifically for Parkinson's. I know there's literature, but maybe Alberto knows more than I do, that fish oil is good for cardiovascular health in general, but it's specifically good for your brain or for Parkinson's, that I don't know. Alberto?
Well, the data on Parkinson they're not convincing data on Parkinson disease, and the data in general on neurodegeneration are a bit mixed. So it's unfortunately one of those questions that we've been trying to answer, but I cannot give a definitive answer yet. And now the Arctic fish oil is also a specific oil, and there's very little data on that because we don't have enough people. The way we study this question, we look at a large number of people who use a product versus people who don't. And then we follow them for 10, 20 years and see the difference. Unfortunately, we don't have the data for a supplement that are not widely used.
Right, thank you. An anonymous attendee says, how to protect against weight loss on Symptomatic or other forms of levodopa, particularly if you're skinny to start with? Well, I think I pointed to the fact that Parkinson patients are at risk of developing weight loss. And in general, weight loss is a bad sign. But we think the weight loss is not necessarily the levodopa causing this, but it's a number of other things. It's reduced intake because people don't swallow as well. The taste has diminished, which may lose your appetite for eating. And people with Parkinson's over time develop what we call a so-called catabolic state. So they burn their calories a bit faster. And then, of course, in a later phase of Parkinson's, dyskinesias, the involuntary movements start to happen, and they simply consume a lot of energy. So it's not the levodopa to blame, please continue taking levodopa and other preparations. They're important for maintaining your health. But see a dietitian and ask them about how to prevent weight loss. Weight loss by itself is not necessarily all that bad. It's fewer weight that you need to carry around. You shouldn't become too skinny. It's not good for your bone health. And try to get your calories not from the carbs, but rather from proteins, but spread the proteins across the day and avoid peaks. That's my amateur dietary advice, but speak to an experienced dietitian instead. Omotola, anything to add?
No, I have a struggle with spreading my proteins with my levodopa because I can't take anything more than 50 milligrams of levodopa at a time. So I'm taking it every 2 hours. Being able to spread that with food is one of the most confusing things for me. So I just don't do it. And that's one of the things that I was talking about earlier, whereby I know what I'm supposed to do theoretically, but practically, I'm not able to do it.
Yeah. There's a colleague, Dr. Malhotra, I hope I pronounce your name right, and he says that he or she advises patients to take levodopa, carbidopa with lemon juice after meals. And after meals, what is your opinion about it? So what we think, and this is what I learned from pharmacists in my clinic, you need to acidify the fluid with which you take your levodopa. So if lemon juice helps to acidify the solution with which you drink your or swallow the pills, then it will work. It's not necessarily the ascorbic acid, it's the acidification. Don't take it after meals though. We generally recommend people to take the levodopa at least half an hour before meals or an hour after meals. And of course, and that's why I'm happy Omotola is here, I realize very well that people need an alarm to schedule their day, their medication intakes and their meals. And I realize this can be cumbersome. At the same time, food can really interfere with the efficacy of levodopa, in particular proteins, so try to spread that over the day. An anonymous attendee says, is salt, oil, and sugar-free diet that is plant-based preferable to the Mediterranean diet? To the best of my knowledge, that has never been studied. I think there is some evidence for the Mediterranean diet, but the diet that you're specifically mentioning, I have no experience. Alberto, have you read anything about this?
No direct evidence from large population studies.
Yeah. A Dutch patient, Sabine, welcome Sabine. I'll answer you in English so the others can understand. What is the best way to keep my bowels moving? And like I said, when I see patients with Parkinson's, the first thing I do is treat the gut. It's essential to drink a lot. Treating constipation without drinking a lot is impossible. One of the tricks one of my patients told me is take 2 empty Coca-Cola bottles or any other juice or whatever you like, fill them with regular water, put them in a visible position in your house, and make sure they're empty by the end of the day. You'll find that to be a big challenge. You'll also find it to be gratifying because it is really helpful to promote your bowel movements. It can also help to prevent a bit of the dizziness when you're standing up, the orthostatic hypotension. In addition, you need a diet rich in fibers. If you don't know what fibers are, go see a dietitian. And if all fails, go see your general practitioner and ask about laxatives. The rule is you need to have bowel movements at least once every other day, and ideally you don't have to push very hard, but it should come easily. If not, try to treat it better. I see lots of patients that improve if I treat the gut. Omotola, do you recognize any of this?
Yes, so for me, what I do is I do drink a lot of water. I have a 3-liter water bottle that I fill at the beginning of the day. And it is a challenge, but I try to finish it by the end of the day. And what I do every morning, because I struggled very greatly with constipation as well, but I take about 3 or 4 ounces of prune juice in the morning, and that seems to help me.
Great.
I'm not sure if there's something wrong with that quantity of prune juice every day.
Yeah. Dietrich Borkhardt says, I like the book. Thank you, Dietrich. Happy to hear that. He says, I intensified aerobic sport and jogging. It does go along with weight loss, although I feel a lot better. So what do I do? Weight loss or intensive sport? And I strongly recommend all of you folks to follow Dietrich's example and exercise. Exercise is a way of suppressing your motor symptoms. It helps to alleviate many of the non-motor symptoms, including the slow bowel movements, including sleep. It helps to maintain a better bone health. And our latest research, although preliminary, suggests that maybe exercise could help to slow down the progression of Parkinson's. Alberto, you've done a lot of work in this field. Would you like to add here?
I entirely agree. Exercise is associated even with a lower risk of developing Parkinson's disease. I suppose most people know there is a long prodromal phase to Parkinson lasting 10, 15 years. So presumably those interventions that delay the onset of Parkinson are also beneficial in people with clinical disease.
Yeah. Vipul Karia says, any particular diet recommended for vegetarians who have PD? Now, I seem to remember, but I'm resorting back to Alberto. I think veggies have a lower risk of developing Parkinson's, or I believe that, or there have been some good recommendations. I don't know of any specific recommendations once you have Parkinson's disease. Would you like to add here, Alberto?
Well, the vegetarian diet is rich in fruits and vegetables and all the antioxidants that we discussed before. So it's not it complies with in large part with the Mediterranean diet to some extent. So in that sense, it's probably already better than the traditional Western diet.
Yeah, thank you. Amy Lindbergh says, what are your thoughts on the use of Miralax? I presume that this is a laxative to aid in. I can use it on a daily basis, says my gastroenterologist, as well as a high fiber diet. So I think we already talked about a high fiber diet that is absolutely recommended for all of you folks. If that works alongside with drinking a lot of water, then you're fine. If not, a laxative such as Miralax could be a good way to move forward. And your GP, and if needed, in the worst case, a gastroenterologist will be able to tell you more about the dosing. I can tell you that I know of a lot of patients who take a laxative and then stop it after a while. Once you need a laxative, it's probably lifetime, which is fine. Make sure you have regular bowel movements and don't stop the laxatives.
Professor Bloem,
all right. So, yeah, go ahead.
Real quick, when it comes to probiotics, is there such a thing as too much, or can you take as much as you feel you need? Probiotics.
For probiotics, I think we need to be cautious with the probiotics. So just a quick story is, there's a tight link between the gut and the brain. We now understand that there's a tight link. We also know that probably the gut microbiome is different in people with Parkinson's compared to healthy people. How that plays a role in mitigating the risk of Parkinson's or the symptoms once you have the disease is not entirely clear. A probiotic could change your gut microbiome, but it could change it for the better, but perhaps even for the worse. So there are also concerns that certain probiotics might make things worse. So except for the one study that I mentioned, the evidence out there is still limited. So I would personally be cautious with probiotics at this point, and certainly not overdose. Alberto, anything to add here?
No, I agree. We are trying to study the microbiome in diet microbiome and Parkinson's disease. It's work in progress. Probably in a couple of years, we will know much more than we do today.
Okay.
Yeah. I'm very excited to read that Professor Ray Dorsey is among the delegates today. By the way, we are with over 180 people, which is amazing. And Ray has a question for you, Alberto, whether the risk of milk or dairy intake is related to fat or brain soluble pesticides, or whether it is the milk itself. What do you think?
Hard question. I was leaning toward not being the pesticides because, you know, except for the Hawaii story that you mentioned before, I don't think globally dairy products are known to be a major cause of pesticide exposure. And dairy also have other effects, including reducing the level of uric acid in blood that we found to be related to a risk of Parkinson's disease. So the jury's out, but I'm leaning toward thinking that it's not mostly or only pesticides.
All right, thank you very much. There's another remark which by Ken Schiff. Thank you, Ken, for joining, who lives with Parkinson's, and he says, let's focus in this webinar particularly on the folks who already have Parkinson's rather than the risk of developing Parkinson's in the future, and I couldn't agree more. And I hope, Ken, that you've heard a lot of practical advice on slow bowel movements, on the orthostatic hypotension already, spreading your proteins, and there will be much more to come, I promise. Pamela Patterson says, is there any evidence that resveratrol, which is an antioxidant, has an effect? I mentioned it briefly in my slide presentation. I think antioxidants have been tested. Coenzyme Q10 has antioxidant effects. Vitamin E has antioxidant effects, and all studies have been found to be negative. It doesn't mean that antioxidants don't work. There's a concern about the dose and whether anything you take orally through the mouth reaches the brain and the right place in the brain at the right concentration. But I think so far there is no supportive evidence for antioxidants.
What
Omotola,
about anti-inflammatory? If Parkinson's is a systemic inflammatory illness, shouldn't we just be taking anti-inflammatory supplements or foods?
I'm passing this one on to Professor Ascherio because there have been studies on the link with NSAIDs, haven't there, and also rheumatoid arthritis patients. Do you want to cover that topic?
Yeah, we did quite a bit of work over the past 20 years, and we had some signal that people who regularly take ibuprofen tended to have a lower risk of Parkinson's disease. The signal is not very strong. It's been, moderately consistent, but to be honest, we've been able to, to draw it to a conclusion and see it is or it isn't. So we're still there. There is evidence that it might reduce the risk of Parkinson's disease, but I don't feel confident enough to say, go ahead and take anti-inflammatory. I don't think we are quite there to make
Did the study focus on NSAIDs, or did it also take into account supplements like turmeric and other anti-inflammatory?
The study was referring now was mostly on NSAID, on taking drugs, ibuprofen particularly, that has a stronger effect probably than most dietary supplements. In terms of diet, and going back to the resveratrol, so it's very difficult to isolate the effect of a single compound because people eat foods that contain many of these compounds. We had some evidence on flavonoids as a class of compound that have some antioxidant properties, but they're not only antioxidant in the sense that they there is a lot of complexity. We're talking about dozens of different chemicals that do cross the blood-brain barrier, and we found that people with a higher amount of this compound tend to have lower risk of Parkinson's disease. And some evidence also, of less neurodegeneration in terms of cognitive decline.
Yeah, thank you, Alberto. Rochelle Flanagan, who I know is a Twitter friend of mine, welcome Rochelle, nice to see you here, asks about homocysteine and Parkinson's. Homocysteine is a compound in the blood that in some reports was elevated in people taking levodopa, and homocysteine in turn is related to the risk of atherosclerosis and thereby maybe experiencing a heart attack or a stroke in the brain. the increases have been only modest. It's definitely not a reason not to take levodopa anymore. And there seems to be a link also with the vitamin B levels that we talked about previously, and for which the latest idea is now to at least periodically check your vitamin B levels. So that would be my practical advice. Ken Schiff has a question about functional medicine, which he embraced 18 months ago as an alternative for our traditional or allopathic medicine. I will be brief there, Ken, by just saying that anything that helps my patients is welcome to me. I raise the flag anytime my patients improve. At the same time, what I prescribe as a physician is evidence-based medicine that's been taken to the test in clinical trials. I think a lot of the interventions that are out there, such as functional medicine, potentially hold promise, but have still been poorly studied. And as I also mentioned before, any intervention could have side effects, could cost you money, and it could cost you time. So I would be cautious myself in prescribing functional medicine, not to say it doesn't work or that it is nonsense, far from, but just to say that it needs better study. And until then, be critical yourself. And if in doubt, ask your physician. And a good physician thinks with you in deciding about the best treatments. Omotola, what about complementary medicine, or what people call alternative approaches? I dislike the term myself. I think it's a continuum. What is your take on this?
For me, I am open to looking into it. Part of the reason is because, I mean, we see our neurologists 2 to 3 times a year at best. And I personally, when I got diagnosed, did not want to take medication. And I tried to look for any other alternative to medication because of the side effects. I didn't find any that worked for a sustained period of time. And obviously I'm back on levodopa and the regular Parkinson's medication. So I think people can explore them, like you said, but they should be careful and cautious in whatever recommendations they get. And I do think they should follow up with their doctors.
Yeah. All right. Thank you, Omotola. Judith Becker, welcome, Judith, for joining us today. Says problems with swallowing also impacts on how nutritious a diet one can eat, and that is absolutely correct. I could not agree more. I might want to also add the loss of smell, which can also impact on your ability to enjoy food. The cookbook, and I know that Ray Dorsey's on the line, but we should really translate that Dutch cookbook into English, because it has all sorts of recipes that are specifically for people with Parkinson's, taking into account dexterity preparing the food, the swallowing problems, inserting the food, and also the lack of smell. So let's work together on a nice cookbook specifically dedicated for people with Parkinson's. Pamela Patterson says, what is a good vitamin D range level? And that really depends on the laboratory where it's being tested. So there's no generic answer. There are normal values in each center where you have it tested, and just refer to the normal levels. Now, Amy Lindberg, Amy, thank you for asking this question, says, what are your guidelines on wine? And what is the potential impact on neurons? I will not push that question to Alberto, because as an Italian, of course, he will answer very favorably. You may know that, of course, there's a lot of literature on the health effects of wine. And the latest big study and meta-analysis in the Lancet was actually negative. I think we've long wished to believe that wine was good for our brains and health. Probably, if you critically look at the literature, there's not much good evidence for this. At the same time, I always tell all my patients, you first have to live your life, and then Parkinson's disease comes in the second or the third or the fourth place. So I tell all my patients, enjoy wine in modest quantities. Take 1, maybe 2 consumptions on occasions. Even when the medication prescriptions say that don't do it, I will tell you do it, but don't overdo it. Do it in modesty, enjoy it to the fullest, but do it because you enjoy it and not particularly because it has a health effect. Alberto.
I agree.
Should we avoid taking it with our medication, or is that not a problem?
You know, certain medications can have sedative effects. And if you read, you know, the notorious list of adverse effects, it will invariably say, don't take this with alcohol. My experience is, if you do it in the evening, when you don't have to go out, and you do it modestly, one consumption, even when it's recommended not to do so, I think you can safely do it. Lead your life first, enjoy it to the fullest, but don't overdose it. Then there's a question by Ken Schiff on A1 and A2 milk, but this must be a very American thing. I have no idea. Alberto, help me out here, please. What is A1 and A2 milk?
A1 and A2?
Yeah.
Oh,
all right.
Embarrassing, but I don't know.
Okay, we need, Ken will answer that later. We'll need to get some more evidence there. Kevin Krejci, I hope you pronounce your name right. Any impacts on the impact of probiotics and prebiotics? I think we largely covered that. He says, I tend to have better energy and reduce symptoms drinking organic kombucha and eating more sauerkraut. Wow, pickles, natto, and Greek yogurt. Well, I think a lot of your diet comes close to the Mediterranean diet. I don't think specifically what you're doing is necessarily what all folks need to do. I think a lot of people with Parkinson's will find out that certain diets are better for them than other diets. And I know of some patients who can think about eating fish and the levodopa won't work anymore. And there are people who take their medication with Dutch cheese and are not harmed at all. So try something that suits your appetite best. Anita Mateus says, is it true that coconut oil helps with memory and renewal of cells in the brain? Anita, I wish it were true, but to the best of my knowledge, no evidence for that. Omotola, you take coconut oil?
Not out of the ordinary.
No, and I don't think there's any evidence. Jaspreet Kamal, welcome Jaspreet. My mother's diagnosed with Parkinson's 5 years ago. Syndopa Plus is the main medicine she's been prescribed. Medicine never worked on her, and her motor and speech is almost zero now. Very stiff. So, first of all, I can't answer specific individual medical questions, but the generic answer here is twofold. One is, if the medication doesn't work, that is a red flag that it is maybe not Parkinson's disease, but it could be atypical Parkinsonism. So this would be a moment to go back to the original physician and reconsider the diagnosis. It could be multiple system atrophy or PSP or another form of atypical Parkinsonism. At the same time, make every effort to ascertain that the gut is working. We see people with bona fide Parkinson's who have no red flags, no alarm symptoms, who must have Parkinson's. Don't improve on the medication until you tackle the gut. Bacterial overgrowth, slow bowel movements, delayed gastric emptying. I would make very sure that the gut is working. And if the levodopa through the mouth isn't working, I would definitely consider a rotigotine plaster. That's a medication that goes through the skin and bypasses the gut. And if needed, apomorphine, which is an injection of a very powerful dopaminergic agent to make sure that there really is no dopa responsiveness. So reconsider the diagnosis, treat the gut, and consider alternative routes for dopamine medication.
Professor Bloem, in your experience, is that standard practice for neurologists to focus on the gut? Because I'm not sure that is.
Well, it's a very good question, Omotola, and it relates to Rochelle Flanagan's question whether a dietitian should be part of standard care in Parkinson's. And the answer is yes for both of your questions. I think paying attention to the gut is part of routine clinical care at every consultation for people with Parkinson's. Parkinson's starts in the gut for many patients. Slow bowel movements are very common. They impact on the efficacy of the medication. It impacts on your appetite for food. It needs attention. Sometimes the doctor or the Parkinson nurse can do wonderful things. I often refer people at least once to a dietitian. I think that is part of standard care. Amy Lindbergh says there is a strong internet following for a particular doctor in Italy, Dr. Constantini, on high-dose vitamin B1 for slowing or halting PD progression. Are you familiar with this? To the best of my knowledge, Amy, no well-controlled studies to demonstrate this. In fact, sad as it may be, there is no intervention at all that can halt or slow down progression of Parkinson's today, except for maybe regular exercise. I would certainly not overdose vitamin B1. As I pointed out, it could have side effects. Darcy Blake says, is there any specific dietary recommendations if you've had deep brain stimulation? The very short answer is, Darcy, I never even thought about this specifically, and to the best of my knowledge, no specific dietary recommendations. Rochelle says, Omotola, were you ever referred to a dietitian?
No, I wasn't. But when I asked for one, I got one.
Okay, and so you have seen a dietitian, but you were not referred?
No, and it's a long story. This was with my previous doctor, a neurologist, and even when I did see the dietitian, it wasn't somebody who was experiencing Parkinson's, and she wasn't able to give me any relevant information.
Okay, very good. Alberto, we're closing on the hour. Is there anything you would like to share with the folks on the line?
Well, I think we didn't touch the caffeine. I thought I just briefly mentioned that, because when you asked me about the dietary factor, one of the strongest factor inversely related with risk of developing Parkinson's disease is caffeine. And the animal model there seem to support a causal effect, but in humans there is no compelling evidence from trials. So it's something to be aware of. I think people already drink coffee to what is ideal for them. So probably for most people, there is not much to do except just to enjoy their coffee if they like it.
Yes.
But it's an interesting aspect of it.
Yeah, thank you for adding, Alberto. I promised to get back to that and I forgot it. Omotola, any final closing words?
Yes, two quick things. Number one, on the book, I read the book, I really enjoyed it. It has inspired a lot of conversations between myself and some other people in the Parkinson's world. And one of the things that it did for me, for those who haven't read it, was it just made me realize that as active as I am in the Parkinson's community, I'm not angry enough, I'm not uncomfortable enough. And to a large extent, even though I didn't think so, I've been complacent. And the book really inspired me to get up and want to take further action in trying to end this disease. So thank you to you and the other, to Professor Oko, to Dr. Oko and Professor Darcy for writing the book. And the second thing was, the first question you asked me at the beginning of the session was, what's my diet like? It's not great. And one of the things that I wanted to say was, I know you did a study whereby for exercise, where you incentivize people to go get on their bikes for a certain number of time. And I was just wondering if something similar can be looked into, helping people to change their behavioral patterns towards food.
Yeah, I think that is a very good point, and I think we should pick that up. I wanted to thank both of you for joining me today. Omotola, you are a true ambassador. And very inspiring to hear you. Thank you for making the time. Before we close, I hold up this book one more time. It's called Ending Parkinson's. It's a book full of hope. It's a call to action. I've heard many positive responses about the book. All proceeds go to Parkinson charities, but it makes you an ambassador for Parkinson's. I hope you will buy the book and support the good cause. I know we've only touched upon half of the questions. I already can promise you that I will do another one on diet. We will organize that, so we will move the questions that we haven't answered today forward to a next session that I will personally join myself. In the meanwhile, I want to thank you for your attention. We've had a glorious turn up. Buy the book, read it, become an advocate, So to make sure that we help improving the lives of people with Parkinson's today and prevent and protect our future generations from developing this. Thank you very much. Be safe in the time of the corona crisis. And I hope to speak and hear from you very soon again. And thanks to the panel. Wonderful job.
Thank you to everyone.